Today we are going to explore on what negative effects tobacco products may have on one's body. How does smoking and the use of tobacco affect your life? What ways could it affect someone's daily life? Day to day, smoking tobacco could increase anxiety and agitation, have you problems with trouble focusing, decrease appetite, increase risk for gum disease, your wounds take longer to heal, your immune system functions decrease, you have an increased risk of type 2 diabetes, your smell and taste decreases, premature aging of skin, bad breath and stained teeth, risk of cardiacs, lower bone density, higher risk of developing rheumatoid arthritis, increased risk for age-related muscular deterioration, which can cause blindness, and increased risk of peptic ulcers. Now, what kind of chemicals are in tobacco products? The main one is nicotine. Nicotine is the most addictive chemical in tobacco products, and it's what causes people to relax, and it's the chemical feeling that people chase when they're smoking or using tobacco products. Arsenic and ammonia. Arsenic is a metal, and ammonia is a poisonous gas. Radioactive elements such as uranium. Benzene is a cancer hazard, can cause central nervous system damage. Carbon monoxide, a deadly gas. PHAs, a group of more than 100 different chemicals that are released from burning coal, oil, gasoline, trash, tobacco, wood, and other organic substances. What diseases do having an exposure to these chemicals may cause? COPD, chronic bronchitis, emphysema, peripheral artery disease. Are there any benefits to quitting that you'll notice right away? The answer is yes. Your food tastes better, your sense of smell returns to normal, your breath, hair, and clothes will start to smell better, your teeth and fingernails will stop yellowing, ordinary activities will leave you less out of breath, and you can be in smoke-free buildings without having to go outside. How to quit. When you start quitting, there's a couple things you should put into place. You should set a smoking date and make a plan. It's important to pick a quit day. Quit days are the days that you will completely stop smoking and everything will be out of your house. You clean out everything. Prepare for your quit day. Pick a date and mark it on your calendar. Tell your friends and family. Get rid of all your cigarettes and ashtrays at your home, car, and work. Stock up on oral substitutes such as sugarless gum, carrot sticks, maybe some hard candy, cinnamon sticks, coffee swirls, straws, or toothpicks. Decide on a plan. What will help you stop smoking? Practice saying, "No, thank you, I don't smoke." Set up a support system. Ask family and friends who still smoke not to smoke around you and not to leave cigarettes out where you can see them. Think about your past attempts to quit. Try to figure out what worked and what didn't. On your quit date, do not smoke. This means not at all. Not even one puff. Stay busy. Try walking, short bursts of exercises, or other activities and hobbies. Try to drink lots of water and juices. Avoid people who are smoking. Drink less alcohol or avoid it completely. Think about how you can change your routine. Use a different route to work, drink tea instead of coffee, eat breakfast in a different place, or eat different foods. This will cause you to have a fresh start, and your body will thank you. Your health improvements include in 20 minutes after quitting, your heart rate and blood pressure will drop. 12 hours after quitting, the carbon monoxide level in your blood drops back to normal. 2 to 3 weeks or 2 weeks to 3 months after quitting, your circulation improves and your lung function increases. 1 to 9 months after quitting, coughness and shortness of breath both decrease. Tiny hair-like structures that move mucus out of your lungs start to regain normal function in your lungs, increasing your ability to handle mucus, clean the lungs, and reduce the risk of infection. 1 year after quitting, the excess risk of coronary disease cuts in half for someone who still smokes. Your heart attack risk drops dramatically. 5 years after quitting, your risk of cancers of the mouth, throat, esophagus, and bladder cut in half. Cervical cancer risk falls to that of a non-smoker. Your stroke risk can fall to that of a non-smoker after 2 to 5 years. 10 years after quitting, your risk of dying from lung cancer is about half that of a person who is still smoking. Your risk of cancer of the larynx, your voice box, and pancreas decreases. 15 years after quitting, your risk of coronary disease is that of a non-smoker. These are just a few benefits of quitting smoking for good. Quitting smoking lowers your risk of diabetes, lets blood vessels work better, and helps your heart and lungs. Life expectancy for smokers is at least 10 years shorter than that of non-smokers. Quitting smoking before the age of 40 reduces the risk of dying from smoking-related disease by about 90%. Quitting while you're younger will reduce your health risks more, but quitting at any age can give back years of life that would have lost by continuing to smoke.